1, 2, 3, 4, 5. Okay. Bismillahirrahmanirrahim. Today we are going to talk about the regulation of blood pressure. This is the class number 2, and the class number 1 we had already explained the concept for the blood pressure and the factor affecting the blood pressure, especially the arterial blood pressure. Okay, so let's start our lecture. As we know that in normal physiological condition, our blood pressure, the arterial blood pressure especially, here I am do not explain the venous blood pressure, the capillary blood pressure, but this is the regulation of the arterial blood pressure. Okay, so in the normal physiological condition, our blood pressure is changed. Sometimes it decrease, sometimes it increase. Okay, so in order to maintain, in order to regulate the blood pressure, our body have two main types of mechanism. One is called the nervous mechanism, and another is called the renal mechanism. Okay, so the nervous mechanism bring the changed blood pressure back to normal in a very short interval of time, about 2 to 3 minutes. And the renal mechanism is a long-term regulatory mechanism. It brings the changed blood pressure for a long time. Okay, for some days, for some months, for some years. Okay, so what is mean by nervous mechanism? Nervous mechanism is a short-term regulatory mechanism. This is a short-term regulatory mechanism, but it is a rapid regulatory mechanism. It brings the disturbed blood pressure back to normal in a few minutes. Okay, so in this topic, I will discuss the nervous mechanism and the renal mechanism. The nervous mechanism, for easily understanding, I will explain the nervous mechanism in order to bring the high BP back to normal position. High BP, when the BP become high or BP become low, the nervous mechanism bring the BP back to normal in a very short interval of time. But in this class, for easily understanding, I will explain the high BP back to normal position by the nervous mechanism, and by the renal mechanism I will explain the low BP back to normal position. Okay, so this is for high BP to normal, and this is for low BP to normal. Okay, nervous mechanism can bring a high BP and low BP to normal, and same as per the renal mechanism. Okay, but for easily understanding, here I explain the nervous mechanism for high BP and renal mechanism for low BP. Okay, so let's start our lecture. So nervous mechanism, as we know that nervous mechanism is the quick regulatory short term rapid mechanism. Okay, suppose there is my heart. Uh, there is my baby heart. There is my baby heart. There is my baby heart. This is the right atrium. This is the right atrium. This is the left atrium. This is the right ventricle, and this is the left ventricle. Okay, so when the BP become high, this is the nervous mechanism. This is the nervous mechanism. First of all, I explain the nervous mechanism and then the renal mechanism. Okay, suppose there the BP become high. There is my blood pressure suddenly speed up. Okay, suddenly high. So, and the aorta, this is the aortic arch. In the aorta, there are present some special receptor which is called baroreceptor, and this is the carotid artery. This one and this one is the carotid artery, and the carotid artery, there present a small area, a small low lobe-like area which is called the carotid sinus. This is called the carotid sinus. Okay, so the wall of the carotid, and here I do not explain the receptor in a big detail because I had already explained the receptor types of receptor in a very big detail in my previous class, the receptor, the wall proof class. Okay, so and the carotid sinus and the wall of the carotid sinus and the aortic arch, there present a special receptor, there present a special nerve ending which is called the baroreceptor. Okay, so what is mean by baroreceptor? It is also called the baroreceptor, or it is also called the mechanoreceptor. Why it is called the baroreceptor? Because why it is called the mechanoreceptor? Because this receptor is activated during mechanical stretch, during mechanical pause. Okay, so when their BP high above normal, when their BP become high above normal, so the nervous system bring the BP back to its normal state by this one process. Okay, by this one mechanism. So when the BP is high, when the BP there is high, okay, so there are present the nerve ending which is called the baroreceptor. The baroreceptor are the nerve ending. When I zoom this area, when I zoom only this small area, only this small area, okay, I zoom this small area. Here I do not explain the phenomena, the process of stimulation of receptor, but giving a just little bit idea. Okay, suppose this is my blood vessel. This is my this part. This is the normal blood vessel, the normal carotid sinus. Okay, there are present nerve ending. These are present nerve ending, which is called the baroreceptor. Okay, so when large amount of blood, huge amount of blood is come here. Okay, so there the this area is stretched. When this area is stretched, it stimulate, it produce action potential, and there when action potential is produced, this action potential is go to the nerve, the central nervous system through the 90H nerve, the glossopharyngeal nerve, by glossopharyngeal glossopharyngeal nerve, and there when stretching occur, then the message is bring to the central nervous system by the 10th nerve, by the vagus nerve. Here what is mean by stimulation? When this blood vessel stretch, there the action potential is produced, polarization and depolarization is produced. Sodium starts, suppose this is the nerve ending, this is the nerve ending, this is the blood vessel, this is the nerve ending. When this area stretch, it stimulate this nerve ending, and there sodium start inward, potassium start outward, so action potential is produced, and this action potential is bring carried to the central nervous system. Okay, so this baroreceptor is stimulated, is activated only during stretching. Point to be noted, this baroreceptor is stimulated only during the stretching mechanism, during the stretching condition, only when the BP become high. When the BP become low, this area does not stretch, so there the action potential does not produce. But when the BP become high, it stretch this area, so action potential is produced, and the message is go to the brain and activate the brain. Okay, so the nervous mechanism, the nervous mechanism control the BP by operating the vasomotor system. What is mean by the vasomotor system? Okay, what is mean by the vasomotor system? Vasomotor system is the system in the medulla oblongata and the lower part of the, this is the medulla oblongata and this is the pons. The vasomotor system consists of the vasomotor center. This is the vasomotor center. Okay, so what is vasomotor system? Number one, vasomotor system consists of vasomotor center. Number one, vasomotor center. Number two, the constrictor fibers, and number three, the vasodilator fibers. Okay, these three, the vasomotor center, vasoconstrictor fiber, vasodilator fiber, combinedly make the vasomotor center, vasomotor system. Okay, what is mean by the what is vasomotor center? Vasomotor center is a center which is present bilaterally in the medulla oblongata and the lower part of the pons. This is the pons, the lower part of the pons. This one. This one, baby, is called the vasomotor center, and the fiber arising from the vasomotor center and distributed all over the body, all over the blood vessel, the vein, the capillary, the arterioles. This fiber is called the vasoconstrictor fiber and vasodilator fiber, but this is the vasomotor center. Vasomotor center is here, and vasoconstrictor and vasodilator fiber is distributed all over the blood vessel. Okay, so what is vasomotor center? Vasomotor center is the center for the regulation of the arterial blood pressure, which is present, which is located bilaterally and the medulla oblongata and the lower part of the pons. Okay, the vasomotor center. Okay, so the message is here, come to the vasomotor center. Okay, then the message is produced by the vasoconstrictor and the vasodilator fiber, and this message is go to the blood vessel and the heart, the SA node, the AV node, the arterioles, the venules, the capillary, and other part of the body by the vasoconstrictor and vasodilator fiber. Okay, so look at this one diagram. It is very more clearly. This is the aorta. This is the carotid sinus. There the message, there the stretching produce the action potential. The action potential is reached. The action potential is reached by the carotid sinus by the ninth nerve, by ninth cranial nerve, and aorta by the 10th cranial nerve. And the medulla oblongata, there present a nucleus which is called nucleus of tractus solitarius. This is the tractus solitarius nucleus which is present in the medulla oblongata. Okay, the tractus solitarius nucleus have a special area which is called sensory area. This is called the sensory area. 1, 2, 3. Sensory area, the vasoconstrictor area, the vasodilator area. These all area are this one, these three area combined together and make the vasomotor center. Okay, so what is vasomotor center? Vasomotor center consists of the sensory area, the vasoconstrictor area, and vasodilator area. Okay, so the vasoconstrictor area and vasodilator area is present out of the nucleus of tractus solitarius, but the sensory area is present inside the nucleus of tractus solitarius. Okay, so the message is reached to the sensory area. Okay, so when the message is reached to the sensory area, there the sensory area decide the message. What is the what is mean by the incoming of the message to the sensory area? Okay, when there the message is produced, it means the BP is high and it is need to be brought back to the normal. Okay, so the sensory area detect that the BP become abnormal. So in order to bring the BP to the normal state, the sensory area inhibit this center, the vasoconstrictor center, and stimulate this one center. Okay, and it also carry impulse to the kidney. This is the adrenal cortex. Here I do not explain this one, but I will explain this one in the renal mechanism. Okay, so here I do not explain this one in a clear full way. Okay, so it inhibit the vasoconstrictor area. When the vasoconstrictor area, there the message does not pass, but there the message is passed. Okay, when the vasoconstrictor area is inhibited and the when this area is inhibited, no message is passed here. So stop. There are vasodilator fiber, some are vasoconstrictor fiber which is present here especially. Okay, so there the cardio acceleration is stopped. There the message is go to the SA node, not the message to the SA node is stopped. The message to the AV node is stopped. Okay, so there stop the message to the SA node and the AV node. So cardio acceleration is slow down. Okay, and when this message is stopped here, the vasoconstriction stop. The message to the message for the constriction of the message for the constriction of the blood vessel here is also stop. So the blood vessel does not constrict and remain in dilation. So it is a when this area inhibit, it stop the acceleration of the heart. It slow down the acceleration of the heart in order to bring the BP to the normal level. Okay, it also inhibit the vasoconstriction. When the vasoconstriction inhibit, so vasodilation start. The blood vessel become dilate. Here the blood vessel become dilate. When the blood vessel become dilate, the BP is there. In the narrow blood vessel, the BP is high, but in the same volume of blood, when the blood vessel is dilate, the BP become shut down. The BP become low and bring to the normal level. Okay, another most important point, it stimulate the vasodilator area. When vasodilator area stimulate, then vasodilation start. The dilatation of the blood vessel start. When the blood vessel dilate, then the BP is decreased. Look at this one diagram. Where is my another patch? This one. Okay. When the message is come here, the vasodilation occur. There is the same amount. There the BP become high. There the message is go to the brain, and from this area to the brain, and the message is again come to the by the vasoconstrictor fiber, vasodilator fiber, and vasodilation occur. When vasodilation occur, same amount of blood is here, as we know that. So the BP become slow down, okay, and come to the normal level. Okay, here, as we know that this is a simple concept. As we know that these are the arterioles and these are the capillaries. Suppose these are the capillaries. This is the there is a ring. This ring, when this ring constrict, then the flow of the blood to the capillary is slow down and it increase the BP. Okay, so when there the dilatation of blood vessel occur, this ring become dilate. When this ring become dilate, more amount of the blood is go from the arterioles. This is the arterioles, this is the capillaries. Okay, so more volume of blood is coming here to the capillaries, and therefore the blood pressure is fall down to the normal level. Okay, so this is the nervous mechanism which cause vasodilation. Okay, so when the BP become normal, when the BP become normal again, when the BP become normal, there is no message is produced, there is no stretching is produced, no stretching, no message, no stimulation of vasomotor center. Okay, no stimulation. So the look at this one, does not stimulate this area, but there the message is passed, but there the message is stop. Okay, so the message is go to the SA node, the message is go to the AV node, the message to the SA node, the message to the AV node is go normally. Okay, so there is a normal condition now. Okay, so this is all about the nervous mechanism. Another most important mechanism, the renal mechanism. This one is the renal mechanism. Renal mechanism is a the renal mechanism also called slow term regulatory mechanism. It regulates the blood pressure by a slow way. It regulates the, as we know that nervous system is the system which is adapted to a certain situation. When the BP part of the patient every day, every time as decrease or increase. Okay, so the nervous system is adapted to the changed blood pressure. Okay, so it does not detect the change blood pressure because of the adaptation of the nervous system. But the renal mechanism is the only mechanism which does not adapt it, but it regulate, it maintain the blood pressure even up to days, even up to months, even up to years. Okay, so this is this is a slow term regulatory mechanism, but long term regulatory mechanism. Okay, renal mechanism is mainly controlled by the, this is the nephron, as we know that. Here I explain the renal mechanism by bringing the low BP to the normal, by bringing the low BP to the normal. Okay, there the BP is low. Okay, this is the apparent arteriole. The apparent arteriole, there the amount, the volume of the blood is low. Okay, so when low blood, when low volume of blood is passed here to the renal corpuscle, this is the renal corpuscle, this is the renal tubule, this is the proximal convoluted tubule, PCT, lobe of Renal, and distal convoluted tubule collecting duct, as we know that. Okay, here I do not explain the nephron, but when the apparent artery, when the low BP blood, low volume blood is passed here, there present a special smooth muscle which is called the Purkinje. This Purkinje work like the endocrine gland. The Purkinje detect the low BP here. There the BP is low. It detect the low BP. Okay, when the low BP is passed here, it release a hormone, a special enzyme which is called renin. This is the very native enzyme. It release the enzyme. Okay, the renin. When the low volume blood is coming here, okay, least amount of glomerular filtrate is produced here. When this least amount of glomerular filtrate is passed here, there the speed of this filtrate is slow, because there the amount of this filtrate is slow, there the amount there low amount of filtrate here. Okay, so this low amount of filtrate is passed here, there the speed of the filtrate is slow. Due to this slow speed, sodium is reabsorbed from this tubule back to the extracellular space. Okay, large abnormal amount of the sodium is absorbed here. Okay, so when this abnormal amount of sodium is passed here through the distal convoluted tubule, and in the wall of the distal convoluted tubule there present a structure which is called macula densa. Macula densa is the structure which is present in the wall of the distal convoluted tubule. Okay, so it detect the low level of the sodium here. The Parkinson detect the low BP and release renin. Here, the macula densa detect the low level of the sodium, abnormal low level of the sodium, and it produced nitric oxide. Nitric oxide. When nitric oxide is released by the macula luta, this nitric oxide give message to the renin, to the Parkinson. So the Parkinson release further renin. Okay, so it release further renin. So this is the key point, the renin. Okay, so what does the renin? When renin is produced here, this renin is enter to the blood vessel. This is the blood vessel. This renin enter to the blood vessel, to the veins, to the venous blood vessel, and this renin is bring to the liver. Okay, look at this one. This renin in the blood vessel is bring to the liver through the venous blood, through the veins. Okay, so when the renin, this renin is the enzyme. This is the native enzyme, very danger enzyme. Okay, and the liver there present a protein which is called angiotensinogen. Angiotensinogen is the protein which is present in the liver. This is the liver. Okay, this one is the liver. This enzyme, the renin, convert the angiotensinogen into angiotensin 1. It converts this one into angiotensin 1. Okay, then the angiotensin 1 is carried through the blood vessel. This is the alveoli. This is the alveoli of the lung. This is the, as we know that these are the alveoli. They are present many of the alveoli. Okay, this alveoli is covered by the blood capillaries. These alveoli are covered by the blood capillary. Okay, so this is the endothelium. This is the single layer endothelial cell. Okay, this is the blood capillary which cover this alveoli. Okay, so this endothelial cell surface have a special enzyme which is called which convert angiotensin 1. When this blood is passed here, there present enzyme which is called angiotensin convertase enzyme. Angiotensin convertase. This enzyme convert 81 to 82 angiotensin 2. So here angiotensin 2 is produced. Okay, so when this angiotensin 2 has come out from the lung capillary to the external body part, the external blood vessel. Okay, this angiotensin 2 doing many important function. It contract the veins. Angiotensin 2 contract the vein. Look at this one diagram. As we know that about 70% of the blood is contained here in the vein. This is the artery, this is the arterial system, this is the venous system, this is the capillary. Okay, so large amount of blood is present here. Okay, so this veins when this vein contract, there the venous return increase. Large amount of blood is coming to the heart. Okay, so when the venous return is increased, venous return to the heart, so it increase the preload here. Here the venous return is increased, it increase the preload. So here come large amount of the blood. When the veins contract, large amount of the blood come to the left ventricle. So okay, so when the large amount of the blood is come here, the ventricle contract forcefully. Okay, so it increase the systolic blood pressure. As you know that from my previous class, it increase the systolic blood pressure. Okay, so it bring the blood pressure back to increase the systolic blood pressure. Okay, another most important function of the 82, increase total peripheral resistance. It contract the veins. Large amount of the blood is coming here. Okay, another point, it increase the total peripheral resistance, the TPR. It increase the TPR. What is mean by the TPR? This is the artery. These are the arterioles, and suppose this one is the capillary. Okay, this is the arterioles. This one is the capillary. Okay, there present a ring which is called, this ring is made from the smooth muscle. Okay, so when this ring contract, it does not allow more amount of blood. Okay, it does not allow the more amount of blood to flow from the arteries to the capillary. Okay, so here when this ring is contract, very less amount of blood is flow here. Okay, when this ring relax, large amount of blood is flow here. Okay, so it increase the total peripheral resistance. Total peripheral resistance is the resistance to the flow of blood from this point to this point. Okay, so this ring contract, large amount of blood is maintained here. Okay, so it increase the total peripheral resistance by constriction of this ring. Okay, this ring is present among the capillary and the arterioles. Okay, so large amount of blood is maintained here. Okay, and there the vein is contract. Number one, when contract, large amount of blood is coming to the heart. Okay, the TPR increase, large amount of blood is maintained here. Okay, so it increase the BP, so increase diastolic blood pressure. Total peripheral resistance increase the diastolic blood pressure, as we know that from my previous class. Okay, another most important function of the AT2. AT2, angiotensin 2, come and act on the kidney. Act on the kidney, and it release the aldosterone. Aldosterone is coming here and attached here to the principal cell. What is the principal cell? Principal cell, as we know that principal cell, these principal cells are present here, and the distal cannulated tubule. Here are present the principal cell. Okay, so the AT2 stimulate the adrenal cortex. Adrenal cortex release aldosterone. Aldosterone stimulate the P cell, and the P cell, the main function of the P cell is to reabsorption of water and sodium. Okay, so there the reabsorption, when I zoom this area, suppose there is the P cell. This is the P cell. Okay, so sodium and water is absorbed from this filtrate to the P cell, and from the P cell to the extracellular fluid, and then from the extracellular fluid is back to the blood vessel. Okay, so it increase the BP. It increase the volume of the extracellular fluid, and some amount of the water is go back to the blood vessel. Okay, so it increase the blood volume and increase the BP. Okay, so this is a very special mechanism, very special and very interesting mechanism. Okay, more look at this one point. Sensitive area, when the BP become here, it inhibit this path when the BP become high, but when the BP become low, it stimulate the adrenal cortex. The adrenal cortex release epinephrine. The epinephrine is go and stimulate the juxtamedullary apparatus. What is juxtamedullary apparatus? The Pockenson and macula luta combinedly called the juxtamedullary apparatus. Okay, so the epinephrine is attached here and further increase the release of renin. Renin is directly produced. Renin is produced by the nitric oxide stimulation, and renin is produced by this epinephrine stimulation. Okay, so these are all about the, here the BP is coming again back to the normal position. Here the BP here the BP is low and come back to the normal position. Okay, systolic blood pressure and diastolic blood pressure again increase. Okay, but in the nervous mechanism, the BP is high, it produce stretching, so it again bring back to the normal position, to the low level.